If you work EMS, you carry exposures most people never see. Not just chemical or biological, psychological. The calls that stay with you long after the run report is closed. Layer 4 of the Composite Exposure Index is the section built for exactly that. It is the optional, structured way to log what you experienced during a call, what you saw, what you heard, what you carried. Inside any non-fire exposure report, Layer 4 appears as psychological stress exposure. It is clearly marked as optional, and it does not affect your reportable submission. It is your record, captured in your words and your selections. Layer 4 organizes stressors into 4 groups: operational stressors, emotional and cognitive load, critical psychological events, and animal or K9 exposure events. Operational stressors covers what you encounter on most scenes. Repeat patient and compassion fatigue, prolonged incidents over 30 minutes, distressing audio, assaultive patients, substance abuse and overdose scenes, death odor, prolonged decomposition odor, being unable to access or intervene, graphic traumatic injury, and the most severe visual exposures, dismembered bodies, severely burned bodies, advanced decomposition, and severe tissue or organ exposure. Those last 4 are flagged as critical. Emotional and cognitive load captures the moral weight of the call: provider self-doubt, family present resuscitation, a coworker exposure event, performing a death notification, a known patient, a rescue with a difficult outcome, moral distress when you could not deliver expected care, and resuscitations exceeding 20 minutes without return of spontaneous circulation. Critical psychological events covers the highest impact exposures: civilian death, exposure involving children, suicide or self-harm scenes, violence or threats against providers, mass casualty incidents, a known victim, a fatality during your patient care, pediatric death, and line-of-duty injury or death. Many of these auto-flag the report as a critical incident. And the 4th group, animal and K9 exposure events: animal handling under high stress, injury to a rescued animal with uncertain outcome, animal cruelty or abuse cases, and K9 line-of-duty injury or death. These are real exposures for EMS providers who run alongside law enforcement and animal control. The system also adds factors automatically when the data supports it. If your documented roll duration exceeds 30 minutes, Layer 4 marks the call as a prolonged incident, without you needing to select anything. When you select any factor marked critical, the report displays a critical incident flag. That flag tells command and behavioral health leadership that this call may warrant a wellness check, not a clinical determination, but a prompt for support. Layer 4 does not diagnose. It does not label you. It does not assign fault. It is not a performance evaluation, and it is not a clinical decision. It exists for exposure tracking and trend analysis, for you and for the people responsible for your long-term wellness. The scoring framework draws on established literature: DSM-5 definitions of traumatic exposure, critical incident stress management, NIOSH research on first responder stress, and SAMHSA trauma guidelines. Higher weighted exposures reflect higher documented risk of acute stress and post-traumatic stress injury. Over a career, these exposures accumulate. Layer 4 builds the record, incident by incident, that supports behavioral health follow-up today, and mental health claims years from now if they are ever needed. You ran the call. Layer 4 makes sure what you carried doesn't disappear into a narrative box. Document it. Honor it. Let the record speak. This is Rehab 1584.